Welcome to Orange County Power Players, where we spotlight the personal, professional, and financial success stories of OC's top leaders. Here's your host, Danny Flores.
Welcome back to OC Power Players, where I interview some of the most successful people in Orange County. I'm Danny Flores, your host, and today's honored guest is Dr. Labovitch, zooming in from Orange County. In August 2023, after 16 years in Orange County, Dr. Labovitch launched Smart Health and Wellness in Aliso Viejo, a groundbreaking wellness center designed to redefine healthcare delivery. Current healthcare systems focus heavily on efficiency, often leading to a lack of personalized care. Recognizing this gap, Smart Health and Wellness has been carefully designed to provide holistic, patient-focused care spanning preventive healthcare, comprehensive treatment, and complete recovery. Their innovative approach combines a spectrum of services, advanced technology, and specialized expertise. They leverage tools such as hyperbaric chambers, cryotherapy, IV hydration, and DEXA body composition, amongst others, to deliver a hands-on, individualized approach to health, fitness, and wellness, guided by three fundamental questions. Where have you been? Where are you now? And where do you want to be? They aim to support you at every stage of your health journey, regardless of your current conditions or aspirations. Dr. Labovitch was born and raised here in Southern California. During his undergraduate years at the University of Arizona, he became interested in orthopedic surgery while volunteering as a student athlete trainer worker with NCAA Division I college athletes. He attended medical school at University of Vermont College of Medicine and completed his orthopedic surgery residency at the University of California, San Francisco. Dr. Labovitch is a fellowship trained in sports medicine at the Aspen Foundations for Sports Medicine, Education, and Research. While in Aspen, he gained valuable experience treating sports-related injuries in addition to providing support for local World Cups, U.S. ski team, and mountain biking events. Welcome, Dr. Labovitch.
Great to be here, and thank you very much for giving this opportunity to meet with you and spread the message.
Yeah, no, it's amazing what you've been doing, how you've come and been able to establish your practice and help people directly. Tell us a little bit about that journey and what compelled you to pursue that, and then a little bit about what you do.
Well, going back to undergraduate years at the University of Arizona, I came in from more of an athletic background. I had aspirations of playing college volleyball and played a little bit on a club team, and decided really one day after working with the athletic trainers and physical therapy team that instead of playing on the club team at Arizona, I would switch gears and become a student athletic trainer. I knew that at that point it was pivotal that I focused on my education and just took the sacrifice and all the learning that I took advantage of when I was really dedicated to team sports and focused it on my education. One thing that led into another, and eventually finished up my orthopedic surgery residency at the University of California at San Francisco. I have a passion for the mountains and skiing, and I've spent a lot of time in Colorado. So I did my fellowship over in Aspen, Colorado, which gave me a great opportunity to work with high-level athletes. A little different sport that at Arizona was skiing and mountain biking. And then eventually, met my wife at UC San Francisco, who was also a physician who's a neuroradiologist, and also, and she's fellowship trained in neuroradiology. And eventually we moved down here to Orange County, where we both started working in 2007 locally. One thing that I realized, first and foremost, I'm fellowship trained in sports medicine and also orthopedic surgery, is the most important thing that I could tell most people that come into my office is that you don't need surgery. Let me start off with a little bold statement. In America, the medical system is really built to treat disease and not prevent it. As an orthopedic surgeon that was trained at UCSF. We do a great job, and the residency programs do a great job treating physicians how to do surgery. One of the things that they don't really treat you or teach you and spend time on is the education of the preventative side of orthopedics, the rehabilitative side of orthopedics. It came clear really early on in my practice when I moved down here in 2007 that, especially being a sports medicine physician, for example, let me give you an example of what I do on a daily basis. I see a whole plethora of injuries from pediatric to geriatric age, 60s and 70-year-olds with knee pain and back pain, hip pain. And then I see different things that obviously from an orthopedic surgery standpoint, if someone comes in with a broken bone that's going through the skin or sticking out in a position that's not really in a good position, then obviously those are the patients that will take to surgery right away. And they have to, really, there's a good indication that you need to fix that, put a plate on, put the bone back together. And that's very simple and straightforward. Mm-hmm. What you realize as a sports medicine physician is that really only maybe 2 to 3% of patients actually need surgery when it's more of a chronic overuse type of injury, or I call underuse injury, where individuals aren't really taking care of themselves well from an exercise standpoint, a physical standpoint. And what they need is they need direction. Now, a lot of people in our community and in our country think that a magic pill or certain modalities are the key, especially like surgery is an easy fix for most of their pain and their individual pain that they have. But the truth is they really need direction. They really need education on how they're planning for their last 50 years of life so that they can live a very healthy and active lifestyle, so they can get off the floor with their grandkids, so they can go travel and take advantage of all the hard work that they've put in to get to the point where they can really enjoy their quality years of life during retirement. And I really realized early on, most people don't have that direction. Most people don't understand what that means. And sometimes they let it go too far to where it's very hard to go back once you have significant degenerative disease, arthritis in your hips and knees, cardiovascular disease, you name it. So with all that being said, with a collaboration with different doctors and different therapists locally here in Orange County, I realized that when I followed my patient population and followed how most of the patients did very well without surgical intervention, I realized that, number one, I'm a piece of the puzzle. I'm basically the individual or the coach, as I say, where I can look under the hood. I can do things with imaging. I can evaluate by examining a patient, and I can even take some blood lab levels and markers and see really what's under the hood. But the most important part of this process is movement and function. And the other key to this process is the physical therapy part, the motion part. I couldn't do what I do as an orthopedic surgeon without a good therapist and a good team of therapists. I'm going to give Orange County a big plug because in general, our physical therapy offices, whether it's my practice or practices out in Huntington Beach or San Clemente, you name it, I see patients from Seal Beach down to Oceanside. They're a great physical therapist. And I always tell patients they're more important than I am, right? Why? Because I spend a certain amount of time with the patient, but the therapist will spend 10 times as much as time as I spend with really looking under the hood and looking and working with the patient from a functional standpoint.
Right.
So with that, and I'll kind of close, this is a long-winded statement for that answer, but I realized early on that once I identified the key players of therapy and the function of what's important for these athletes and these individuals, not even the athletes, just the patient population in general, you need to collaborate with a good team of therapists. And this is where this collaboration and partnership with Dr. John Kwan, who's a doctor of physical therapy, who's my partner here at Smart Health and Wellness, really took place. And I pitched him this idea of developing this, really, we call it the one-stop body shop, but really it's a movement. It's a disrupting type of building that has everything under one roof to be able to take medicine that is truly, I think, broken in so many ways and really start this movement to help people identify really what it really means for longevity.
No, that's an amazing explanation and an amazing journey and just getting to where you're at and your ability to be able to help patients. Now, you mentioned a lot of things, but when when does somebody know they should veer away from the regular Western physicians and medicine to someone like you that goes has a different approach that's not ready to put you under the needle right away? When do they know when they should be getting checked? Pains or symptoms that they should be feeling so that they start addressing them before it's too late.
It's a very good question. You're talking about longevity. You're talking about a movement that is all over the airways. And it's very clear if people watched the most recent 60 Minutes last week with Dr. Peter Attia, the Andrew Huberman podcast out there. When do you know? Longevity starts at an early age, and it really starts when you're young and you're pediatric age. What do I mean by that? Well, bone density, from an orthopedic standpoint, bone density really starts at an early age. And unfortunately, we're in an era where our foodstuffs are the quality of our food, and also the type of athletes that we're building nowadays with one sport athletes at a very young age potentially are putting these young athletes at risk for having low bone density doing one sport instead of doing multiple sports and cross training like you and I did when we were younger.
Mhm.
What we are doing here is not necessarily a different type of medicine. It is really medicine, as I'll quote Dr. Peter Attia, it's medicine 3.0. This is where the future of medicine needs to go. There are certain biomarkers and lab markers and things that we can do early on to identify individuals that may be at risk for cardiovascular disease, musculoskeletal health problems, or metabolic insufficiency type of problems. And if you identify it with these certain few markers that are out there, and it doesn't necessarily mean we're doing this on our pediatric or our teenagers, but even in your 20s and 30s, we can start you on the right course, the right track, the right direction for function. After all, really, what we focus on here is function, right? Longevity, really, what it looks like, longevity is function. It's not necessarily all these different labs that you can get from these multiple different type of longevity silos that are opening up left and right, where they give you 100 or 200 different labs. What you realize, and what I, fortunately, as an orthopedic surgeon, I have 18 years of experience post-fellowship to understand that if you can't move without pain, you're going to be miserable, in your next 50 years, your second 50 years of life.
Right, right.
All of us are working really hard. We're sacrificing for our kids, our family. We save money. But if you can't take advantage of that when you retire because you can't move, what's the worth of saving all that money? You can't even take advantage to go travel to, and walk the Great Wall of China or Machu Picchu, or you name it.
Right.
What we have under this roof is not only these technological pieces like a hyperbaric oxygen treatment system that's similar to the hospital systems, red light therapy, and different therapies that we use, and more importantly, also data points like VO2 max testing and DEXA body composition. Those are all great data points, but someone has to put that together, which is where I think longevity is, where we're starting to lose that humanism with all this data.
Right. Wow, that's a lot to digest there. I guess you can just keep getting tested and tested and tested and really not have the direction if you're not being directed to living a better quality life. Now, you've mentioned some tools like the hyperbaric chamber, the cryotherapy, the IV. Can you walk through a little bit of each one for audience that may not have heard of them or may have heard of them and don't know exactly what they do and how that helps people's quality of life?
Yeah, so I can go through each one. We do have a lot of more data-proven, evidence-based type of therapies here. Number one being hyperbaric oxygen treatments. Hyperbaric oxygen chambers are also coming out and evolving and growing in the media right now. But true hyperbaric medicine, when we talk about true chambers, are basically breathing 100% oxygen under pressurized air. Okay. Chambers have been around. The company that we use, which is Seacrest, which is the world's leader, actually is local here in Anaheim. They develop and they build the chambers, and they have all the IP, intellectual property for their beautiful acrylic chambers to keep that pressure. So hyperbarics has been around in medicine for 60, 70 years and treated regularly, especially for divers that develop caissons or the bends type of disease. And believe it or not, it's used on a regular basis for our subway developers and our individuals digging the subway, and people working, another example is people working in oil derricks offshore. They're under a pressurized situation, so they're always being decompressed. Now, let's take it to now where we're at right now in medicine and being utilized in a regular daily basis for the community. Pressure and breathing 100% oxygen basically is following a physics law called Henry's law, which dissolves more oxygen in solution. Essentially, at the levels that we treat patients, we can dissolve up to 6 times more oxygen in the solution in your blood volume. And what that does is it goes to areas of your body that normally small red blood cells can't get to. It's well known and there's enough evidence, and there's great evidence in the literature that wounds that are hard to heal, like diabetic wounds or even open fractures that don't have a good blood supply, we now know clearly that hyperbaric oxygen treatments are the standard of care, and this is evidence-based in our literature. So this was a perfect example that at the cellular level, it helps with revascularizing those tissues at a very small level. It helps decrease the inflammatory component, no matter if it's inflammation that's caused by systemic inflammation. For example, now we know it's a standard of care for inflammatory bowel disease and different inflammatory type of processes through the body. Post-surgically, it can be used to help really decrease the inflammatory nature of what we cause at the time of surgery. When we do surgery, it's basically controlled trauma with a knife that's under sterile conditions. We're still causing trauma, but we're basically utilizing the hyperbaric to decrease that inflammatory component and let the body start healing right away. It's also being used now, and it's been well studied for long COVID. Long COVID, especially with brain fog, and the neurocognitive issues that patients will have, fatigue issues, there's over 2,000 studies on long COVID and how hyperbaric treatments are changing the way that patients ultimately in the long run improve their neurocognitive problems that they're having with this. So that science is emerging and it's evolving, and especially in musculoskeletal repair, there's more and more data to show that it's helping improve recovery from, you can use it as an athlete where you've trained, or you're going through a bout of training, say for an training block, for whatever you're doing, to basically help recover those tissues quicker. We can use it post-operatively. We can use it for acute hearing loss that's viral, has a viral etiology, a viral problem that caused an acute hearing loss. So these are diagnoses that are really starting to take off, and we're using it in a regular basis in these situations. The other thing that we have here is our system is mirroring the hospital system. It has a tech that's with the patient every second. We have one chamber, so it's individualized. The safety is by far the most important thing that we take seriously, and so everyone is screened ahead of time, and we basically will make sure that they're safe when they go in, because it's obviously they're breathing 100% oxygen, and in a chamber that's really the biggest risk is flammable gases and things like that, and also some of the other side effects. So it's a very serious thing. Unfortunately, hybrid systems are coming out now where people are going into these hyperbaric chambers that are inflatable. There are systems that are kind of a hybrid, which they cannot get to the same levels that a fixed system like a Seacrest chamber does. And right now, I'm just trying to think of the society, the Underwater or Underseas Hyperbaric Medicine Society is really coming down on those chambers in those areas where they're starting to build these hybrid systems, but safety has got to be first and foremost when you start thinking about these systems.
Right.
And those systems can't get to the same level of pressure that you can get to in the true hyperbaric system. Other modalities that we will use, like cryotherapy, has been well known to really decrease the inflammatory process of either post-workout type of inflammation or any type of recovery process that an individual is going through. It also sets the neurocognitive system and really sets off a significant amount of anti-inflammatory type of effects within the body with cryotherapy. There's a lot of emerging science going on to that, even from the neurocognitive and neuropsychiatric type of effects of whole body cryotherapy. We also have red light therapy here, which is a type of therapy that is emerging also. The red light therapy, as you know, is also a type of therapy that works at the cellular level. Basically, the red light therapy hits the skin and those tissues at the mitochondrial level, which are the power chambers of the cell, to really modulate and upregulate a lot of the really the energy stores or the energy systems of the cell. And it's very much being used in a situation where it's also being used for recovery, for skin health. The data on red light therapy at this point is emerging in human studies and different types of indications, and it's still evolving, but it's very much a safe modality to use, and it's something that we can we certainly can offer from a safe standpoint. It's very simple to use. So those are different complementary type of therapies that is part of the whole picture of what we're doing with not only these modalities that are being added to the recovery process, but along with physical therapy and the restorative parts of deep tissue work with our therapists, who are also certified personal trainers, and really developing a whole program that's combined with all these different individuals that are working with an individual themselves to develop a program that will be best for them.
Wow, that's a lot of I guess a lot of different ways that someone can, either if you're an athlete, an active athlete, you can get in there and help your recovery time. If you're somebody that's injured, help with the recovery time there too, or coming out of surgery. Yeah, many different avenues that you have to help people.
Yeah,
that is awesome. Now, as we get ready to wrap up the interview, what exciting things are you working on in the next 6 to 12 months?
Yeah, so moving forward, we are really trying to put all these pieces together. We've actually hired a couple new, an orthopedic surgeon by the name of Dr. Matt Zaff, and we also have a primary care doctor here, Dr. Jeevan Saul, who does sports medicine and has his own practice here. And we're trying to build a team to really grow our message and grow the model to build and expand and increase our awareness with not only people growing with individuals, but we really want to get the message delivered in a way with the most important thing in terms of moving forward in longevity, or at least the assistance in longevity, is making sure that longevity is not about, again, the data points that people can gather from all these different studies, like VO2 max, like DEXA body comp. These are tools that are used to help design these individual programs that we can keep people on track, because no matter what their lab studies show or what their molecules they have within their body or how optimized their numbers are, again, the most important thing is function. So moving forward, we are developing a program called the Smart 360 Wellness Program that is geared at individuals that really want to take advantage of not only these simple biomarkers, this simple set of biomarkers that we can test, whether it's laboratory short number of markers or VO2 max testing or body composition, but we can look under the hood, as I talked to you about it, look at the machine, see where you're at, collaborate with the most important people involved, the doctors of physical therapy, and develop an individualized program for each individual so that they can plan for the next 50 years of their life from a functional standpoint. The most important thing we can do is start planning you asked early on, what age is the best age to start thinking about this? Really, once you start thinking about it, you have to start to put the action into place. And a lot of people need that direction. What we can do here is we can actually work with these clients from day one. We can do the tests very simply. And these tests, the reason why we've designed these simple markers that we are working with is every marker can be intervened. These markers, the whole idea of the markers, whether it's lab markers or your VO2 max test, which is basically the vital sign of longevity. And I can go into VO2 max testing a little bit, but the VO2 max has been shown very clearly as the most important marker for longevity, and even more important than sometimes your blood pressure and other vital signs that, cardiovascular illness and things like that. But VO2 max basically is because if you have if you're basically in the higher level of VO2 max, if you're in the top 25% or 15%, you obviously are living a healthy lifestyle. So your blood pressure and your other vital signs and your other markers like blood pressure and things like that are going to be very much in gear to a healthy type of lifestyle. Taking these biomarkers and taking these simple select group of tests, we can monitor them on a quarterly, semi-annually, annually set of processes and work with these individuals and meet with them and making sure they're staying on course to stay in the green. Green is good. Yellow is concerning. Red is, obviously you're not in an optimized state when you're in red in these different markers that we picked. What we want to do is be able to intervene by working with these clients and working with our patients to say, listen, let's work with nutrition. Let's work with exercise. Let's work with, different things that you can do in a safe fashion. Because as we get older, the degenerative diseases that do take place and do cause pain in your hips and your knees and things like that, you have to know how to exercise when you do have wear and tear on the body. We're able to do that because we have those professionals here. We're able to look at these certain markers and really keep them in the green. And we believe that that's essentially 90% of what you need moving forward to live the best functional life that you can in your second 50 years of life. That's the direction that we're going in, along with developing ties within the community at the middle school ages, at the high school level, to be able to work with our young athletes to help them start to be educated about the issues with overuse and overtraining that is going on really, especially here in Orange County at the athletic level. College sports have basically moved down to the level of basically the amount of training that they do at college sports, which it was 20 years ago, is now at high school level or even at the middle school level when athletes start and young kids start thinking that they want to be a football player or a baseball or soccer player. They start so early on that I am seeing myself as an orthopedic surgeon, these overuse injuries that are just dramatic and devastating when someone already has thrown out their elbow or they have stress fractures that have developed and they're taking them out from a whole season of training. So we really want to be ingrained in the community. We want to be part of the community. We want to be there to help develop this healthy lifestyle.
Wow, yeah, that's so much for all of us, right? To understand and to be proactive rather than reactive in living the last 50 per se, quality of life versus struggling, right? We're struggling and we have joint issues and things that we didn't do to take care of as we enter those years. Well, Doctor, thank you so much for sharing all of that and all of these ideas and services that you provide. If somebody's listening and would like to get a hold of you, what's the best way to get a hold of you?
Well, they can certainly go on our website at smarthealthwellness.com, and there's all the avenues. They can send a message through smarthealthwellness.com, or they can call the direct phone number at 949-520-1012 to find out more information. They can also look at my personal website, but start with our main website at smarthealthwellness.com to really look at all the different modalities and what we are doing to find out some more information.
Wow. Well, thanks so much. And once again, thanks so much for coming on the show. And to our audience, please go to ocpowerplayers.com and follow us on your favorite channel. Thank you, Doctor.
You're welcome. Thank you.
Thanks for listening to Orange County Power Players. Want to share your success story? Apply to be a guest at ocpowerplayers.com/guest.